Hey guys, how are you? This is Dr. Kim. This patient was referred to our school for extraction of all four third molars. So why don't you take a few seconds to look at this radiograph and identify the locations of all four third molars. So why don't we start um, with the upper right quadrant. Here we have impacted tooth number 1 that shows a mesially tipped angulation. So here's 1 and 2 and 3. So now when we look over to patient's left quadrant, how many molars do you see? I'll leave it at that for now, and let's go down to the lower quadrant. We can see a tooth number 17 that it has lost part of its crown, and we see that on this posterior bi-wing radiograph as well. And then as we look over to this side, here we have number 30, 31, again 30, 31, and 32. So yes, we do have third molar on this side as well. So now let's go back here. At an initial glance, it looks as if we have two molars, right? So did the clinician send us incorrect information, or are there really three molars on this side? Why don't we take a look at the other radiograph? So let me play with the contrast a little bit. This was not taken at our school and was imported or transferred to our school, and I see that the resolution is not quite as ideal as I would like to be, but okay. Here's number 14, right? We can kind of make out the outlines, root outline of the distal buccal. Here's a part of the mesial buccal, and we see a part of the palatal root. And then as we look over here, you're starting to see that there's some superimposed image. If I were to outline the one of the roots, here is the outline of that tooth. Again, that's one tooth that I'm seeing. And then here's another one. Do you see that this part of the crown is more radio-opaque than this side of the crown? That means there's a superimposed portion or part of the crown or the tooth. So now you can see that the PDL space of the other tooth goes something like that. Looks like it may have lost a portion of the crown. So here's the other tooth. So here we have 1, 2, and 3 molars. As far as which one's second molar and versus third molar, based on their radiographic appearance and overall root length, I would presume that this is more likely be a third molar, because the root length of first molar is fairly consistent with the length of second molar or this tooth, whereas this tooth is much shorter, and generally speaking, third molars will tend to have a wider range of pulpal and then root anatomic variations, and they tend to be generally smaller or shorter rather than being so much larger. So based on the root morphology alone, I would expect this to be third molar. But as far as why would this located even more mesially than second molar, I have no clue. It just sometimes erupts this way. But what's going to be really helpful is looking at the patient and examining clinically. And when you look at the clinical crown, and if you ask the patient, you could probably easily figure out which one's second and third molar. Having said that, the point of this video is I want you to note that there is another tooth that may not have been obvious at an initial glance. So that's what I want you to see, and I hope you found this video interesting. Please hit the like button and be sure to watch all my videos for your educational benefit. Thank you again, and I'll see you next time.